My name is Pranav,
Hi, my name is Said,
and I will be the doctor in this interaction.
and I'll be the patient.
So today we're talking about disorders of sexual development, and it will be between the doctor and primarily the wife or the mother of the child.
Doctor, why haven't you told us the gender of the baby?
Mr. and Mrs. X, I understand that withholding information will be stressful to both of you, so I will tell you what I know so far. Your child appears to have what we call a disorder of sexual development.
What does that mean? Is the baby okay?
Don't worry, Mrs. X. Our current goal is to first ensure that your child doesn't have any current medical issues. Now, as we speak, the doctors on your team have admitted and are assessing your child to check for any dehydration, salt loss, urinary infections, or any blockages in the bowel. The doctors are managing your child, and I have confidence that the baby will be fine.
Well, if the baby is okay, then why can't you tell me the gender?
Mrs. X, the issue here seems to be that there's a difference between the genetic sex of your child and the reproductive organs they've developed. Basically, based on the appearance of your child's genitals, we cannot be sure if they have a true penis or a vagina, and therefore are unable to confirm the gender with you.
Why didn't we know about this earlier?
Well, it's possible that the doctor reviewing your scans did not suspect any disorders of the genitalia, as they rarely present during pregnancy. In addition to that, special forms of ultrasound scans are usually used to get very clear images of the genital anatomy. Therefore, it's possible that this disorder was missed in your previous regular scans.
So what will you do now to find out?
Well, as for how we can be sure now, there are tests we can run, like a chromosomal study, which will give us a better idea of what the genetic sex of the baby is. We can do an abdominal ultrasound to see the internal structures and various other hormone level investigations.
We were supposed to be naming our child. How could this happen?
I understand this is a very difficult situation for the both of you right now, Mr. and Mrs. X, but I assure you that we will get back to you when we have more certain answers. I do want you to understand that this is not a remarkable condition and it happens more often than you think. We have a good understanding of how to handle and treat cases like these. So as of right now, the obstetrician will make sure that you're stable and return you to your room. They will need to take your pregnancy-related history again to aid our diagnosis. The registration of the child will be delayed until a diagnosis has been reached, at which point they will be returned to you.
What happens then? Does my baby need surgery or something?
Well, once we have a diagnosis in hand, we will brief you as soon as possible on our plan of management for your child. We can tell you at that time which sex they can be assigned to, which will allow for the best fertility potential, sexual function, and so on. But ultimately, you will also have a say in how you would like to raise your child in terms of their gender. We will bring a social worker to talk to you about naming, upbringing, and psychosocial development issues that you may face, and they can counsel you through it. And finally, if everything has been medically confirmed and you're both okay to move forward, we can conduct an early genitoplasty to help correct the reproductive organs in order to maximize their appearance with accordance to their gender, urinary capabilities, and good adult sexual and reproductive functions.
Okay. Thank you, doctor.
Thank you, madam.